Second cardio test we're going to be covering is the 3-minute step test. So it's a really simple test for cardiovascular fitness and recovery. It basically assesses how quickly someone's heart rate returns to baseline after performing a moderate intensity exercise. It is used for older people, clients with limited fitness or joint issues, and is a pretty good test overall. So let's get into it. So really good for controlled environment and certainly ideal for people who can't yet run 12 minutes, okay? Can be done periodically. I like using it with older clients more often than not, and every 8 to 12 weeks is generally ideal for this one, okay? So begin with a 5-10 minute warm-up and use a step or platform that is 12 inches or 30.5 centimeters high. The step needs to be stable on a flat surface, and the client should stand in front of that, be prepared to step up and down in a consistent rhythm. So you step up right foot, down with the other. Step up left foot, down with the other, keeping a steady rhythm the whole way through. So the step rate should be around 24 beats a minute, which is one step every 2.5 seconds, guided by a metronome or count 1, 2, 1, 2 in sync with the steps. They should continue stepping to 3 minutes without stopping. The goal is to maintain that pace of 3 minutes. After 3 minutes, they should sit down and rest as quickly as possible, measure their heart rate of within 5 seconds of finishing the test, and then record it at 1 minute and 2 minutes post-test to see how well they recover. So the primary measurement of performance here is how fast the client's heart rate returns to baseline. So excellent is heart rate drops by 50 to 60 beats per minute or more within the first minute. Good, 40 to 49. Fair, 30 to 39. And poor is dropped by less than 30 minutes. So by less than 30 beats per minute, pardon me. So if the heart rate needs more time to recover, they probably need more recovery, more cardiovascular training to get better outcomes. So ideally, 24 beats a minute, 24 steps a minute, they should have good posture, they should focus on rhythm, just maintain that the whole time. It's not a flat out test. Common faults is people will slow up. So use the metronome there to get people to stick to that. People's posture will go down or they may stop early. So for most people, just make sure you monitor them during the test and you give them the feedback to do things properly. So we have all the performances here. So if someone has a fast recovery, say 50 beats per minute drop in the first minute, okay, they can continue with high intensity exercise. They can go hard. That will get the best benefits for them. If it's average, they're going to be needing to have more low intensity, steady state, and moderate intervals and gradually increase the intensity and duration. And if they got poor performance, you want to start off with walking or cycling and increase duration over time to improve that. So if someone can't do this test, you might do a Rockport walk test. And if clients have any kind of health conditions like dizziness or shortness of breath, you need to stop this test immediately. You can also avoid this test with clients who have joint pain. And if a client has a known cardiovascular condition or significant health issue, probably consult with a doctor before they do the test. The Rockport test will be more appropriate for them.